Hi, this is Dr. Barbara Young, and I want to welcome you to the Transformation Success Television Network, and this is the Total Woman Show. I am so excited we are here for part 3 regarding narcissism, but we're going to be talking about how to find the perfect therapist. So I'm here today again with Dr. Carol Provo, the spotlight guest today again. I had to have her back. And then I have all my new co-hosts again.
Yes.
Kim Yeater. And Kim, tell them what you do because you're a peak performance coach.
I am.
Yeah. What else do you do?
So I'm a peak performance coach working on transformation, helping people that are stuck get unstuck. I'm a speaker and upcoming author of Run Your Race and Discover Your True Identity, and a documentary filmmaker of One Voice, Many Faces, breaking the cycle of domestic violence and breaking the cycle of victim.
Yeah,
good.
She's got a lot
Awesome.
on her plate.
Yes.
Awesome.
Yes.
So we're really happy to have you on the show since you've done so much work with a lot of coaching and a lot of clients.
Yes.
Thanks to have your input on how to pick that therapist. You know, and this is really a show that I don't know many people even see. That how do you pick the right therapist for you? So from personal experiences, you guys, myself, we'll talk about that today. So Carol, take the lead on what are some of the things we need to be, and now should we preface this by saying if you have a narcissistic parent or you're in that kind of relationship, because we're tying this into narcissism, okay? Not just you out there, you know, I need a therapist. We want a particular challenge, right?
Okay, yeah, and in any kind of thing you're feeling uncomfortable with, and the misconception of therapy, and I'll say these two very important things. The misconception is that if you go to therapy, you're crazy. So we want to dispel that right away.
Yeah, that's important.
It is the most courageous thing.
You mean if I go, I'm saying I'm not crazy?
Well, I'm saying you're courageous because you're courageous enough to say, I need some help with something. The other thing, along with that, we think that if we go, we're going to be in there forever. You can actually go in and say, I would like to see you 4 times. I have something that I'm working out. I'd like to find a new job. Anything, we're willing to help with anything. You don't always have to go in because there's something deep going on, because we'll see. We'll see.
One of the things I'm concerned about is that people are having credentials, because we talk. That's one of the things I'm going to talk about, because I got just a plethora of people who are coaches.
Yes.
But are they qualified?
Yes.
Because one of the things, and I'm going to just share this, which I was told, because I have been, counseling and coaching people, that Barbara, there are liability issues, because if I happen to be talking to a client, I'm not certified, in terms of certified with your psych tech. I mean, doctor, you have your clinical psychology and practice. And the thing is, if I'm talking to someone and I'm not certificated or licensed, and that person commits suicide, I could be liable. Their family could sue me, or his family could sue me. So anyway, I brought this up because it sure is important, and I know you're going to address that.
Yes, I am.
Okay.
And so therapy isn't always gloom and doom. Sometimes it's for goal setting. Sometimes it's, but there are different levels of therapists. They're coaches, and I put them in the most broad category. I see my coaching as helping someone find their purpose, helping someone find success in a certain area. If you're going to dig into deep emotions, you should be educated. So there's that second level of, we call them counselors, and we're all counselors, we're all coaches, and we're all, therapists. But formally, there's that next level, and they could be master's level. They're very trained, and they can be licensed at the master's level. I think the license is the key, because the state is going to test you. If you're going to be with severely injured emotionally, you should be well educated, and not that, and well skilled. You should have your skill set. You should have you should have training. You should have diagnostic training. You should know how to diagnose. So there, for me, those 3 broad levels, and not that all of them don't do good work, because they all do good work. But when we talk about severity and injury and emotional injury, like you said, things that lead to suicide, that should not just be anybody that you're talking to. because they may not know how to handle that. And the second important thing is that it's very courageous to say to someone that you need help. The other thing is that you are the lead in your healing. You don't have to feel like every therapist, or you have to accept the one therapist.
Yeah.
Therapists are just like any other profession. There are good ones and there are bad ones. And so you have the right, this is your healing, and to interview your therapist. Don't just go in and go, I'm going to start working with that person. Ask for a consultation. Ask for 15 minutes. I'd like to meet you. Ask for 30 minutes. Could you give me a nominal fee to come in or a free consultation?
Okay.
And interview that person. And if it doesn't feel right, get up and walk out. And go find someone that you feel like you're clicking with. And there's a caveat to that, which we'll talk about later. Because not everybody's supposed to make you feel good when you get ready to do difficult work. So, but just connection's sake. You know, if someone says something off to you, or someone, just like any other profession, if you don't feel comfortable, get up and walk out. And that is your first power play toward your healing. It is your therapy. You own it, and it is about you. It is not about me or any other therapist or counselor. And that's your first sign that, because you're in command, even though we're skilled, and I'm gonna guide you and make sure you hit those bumpers and make sure you don't get stuck. I'm not accomplishing my own agenda. I'm accomplishing yours.
So how do we go about that? So if we're really looking for a therapist, like where do I start? When someone's stuck in a situation, like specifically narcissism, it's overwhelmed.
Yes.
And just to go online and you Google therapist and you don't even know what narcissism is.
Right.
You feel lost. So what's the first step to set someone up for success?
And if you're having some kind of emotional breakdown, or you need help, you may not know that it's narcissism.
Right.
If you need help and you feel emotionally you're not in a good place, there's several ways to do this, because we all have different situations. Some people have insurance, and so they can easily call the therapist on the list, and see. There are other people who don't have therapists, or you may have an EAP program on your job, and there are certain parameters for that. It's public to your employer. You may want to pay out of pocket to keep your employer from knowing your deepest issue. You can always private pay. That is not a problem for any therapist. Those that are on Medi-Cal, there are therapists that accept Medi-Cal. So you can start by Googling. That's what most of us do. But if you want to use and not have to pay, you want to use go to the list on your insurance. They should have the therapist listed in your area. So you're not lost. But the most important thing is to make sure there's a connection. And so I give my clients the power to interview me first. We're not just going to step in, you jump in, and we just jump into. But it is the healthiest. It's like selecting a medical doctor. You don't want anyone without experience.
Well, I was thinking, as you're expounding, there are a couple of factors, and one we're going to talk about that, and that's the cultural implications.
Yes.
The second factor is a person may not know how to interview you.
Yes.
So how would you address
Well,
that?
a meet and greet.
Yeah.
Maybe we'll
Okay.
call it a meet and greet.
That's good. I like
That's
that.
good. I like that.
We'll do a
Because
meet and greet
all of a
session.
sudden,
Right.
I'm thinking of our new cohort that's coming up, our millennials.
Yes.
And they may
Yes.
not know
Yes.
how to even.
I'm glad you brought that
Yeah.
up. So
And
you
then-
do a meet and greet session, just like you would do with an attorney.
Got it.
You go in for a free consultation or a nominal fee of $20. The therapist will let you know.
Right.
And a good therapist will not take offense to that. Somebody
I would
who is
imagine
not
qualified.
There are people who have their own agenda and they won't want to give you any time. So if that happens, turn around and go away.
Oh, yeah.
You do not have to go to any particular therapist if you don't want to. If someone offends you in the middle of something, and I'll make that clear, or they violate you in some way verbally, you can say, excuse
Well, I
me.
don't know why you think that. Why would you think that? No, I'm
Right,
paraphrasing
right.
how a counselor might say,
Right.
I'm afraid that you may be a racist, or you know, somebody might just say
but those
that.
are real issues.
And
Those are real
say, well, I
issues.
don't know where you think that. Where'd you get that from? You know, with that sort
Right,
of spirit.
Right.
Yeah.
Defensive.
Right.
Yeah.
Defensive. Right. And let me say this. I'm glad you said the cultural piece, because I get this all the time. There's a misunderstanding that your therapist needs to be the same culture. I know we think we feel comfortable. If I'm black, I want a black therapist. If I'm Hispanic, and it's nothing wrong with that. But sometimes you can miss the best person in the world.
Absolutely.
Because the goal is to get the person who has the ability to walk with you through your journey.
Absolutely.
And have that empathy, protect you, put the guardrails up so you don't fall off the side, but also challenge you and have the courage to offend you just a little bit. Because they want to push you, they don't want you to get stuck.
Right.
So I want to make that distinction that just because someone challenges you doesn't mean they're not a good therapist. They may see that you're stuck. They may need to make you cry. Maybe you didn't cry for 5 years. Your spouse died 5 years ago,
Right.
and you haven't cried. They know exactly what to do, holding you, and we call it containment. We hold you as you explore, as you go down that journey, and we put the guardrails up so you don't fall over.
Got that.
And so if you could see therapy, and I want to reframe therapy for the audience, for those who haven't had therapy, instead of thinking, I'm sick, I need to go get help, see it as, I'm going to get this out of me.
Yeah,
I'm going
that's
to
great.
release. I'm going to release and get, because as you hear yourself in your inner ear, your emotions become objective. And then you can hear yourself strategically and objective. So I'm going to release today. I'm not going to be somebody's burden. We don't feel like that as therapists and counselors. We are willing, give it to us, get it out of you and give it to us. And it's one of the healthiest things you can do. It's those people who go, I know I'm messed up. I know I'm going to hurt somebody, but I'm going to just go to work and fight everybody then. Versus saying, I have an anger problem. Let me go see. You know, I've had people go in and go, I want to see you 3 times. Can you help me? Sure. This is your
I
therapy.
love it. So what I'm hearing is we get to be in charge of
Yes.
our wellness,
Yes.
our
Right.
psychological, our mental
Yes.
wellness.
Yes.
And we can actually create, you know, a relationship, building rapport, you know, with a therapist
Yes.
and kind of interview the therapist. You know,
Yes.
is this going to
Yes.
really be a
you
fit
can,
for me?
You can say a meeting of the minds. I mean,
Yeah.
you can sense it, I think, in
Yes.
the beginning, if I'm
Yes.
going to really like this person.
Yes. And you want that therapist. I've seen therapists who, if a good therapist doesn't talk a lot, depending on what kind of, and it also depends on what methodology they're using. But they're great listeners, and they know how to lead you through. They know how to allow you to lead them. Now, if you go off, they know how to block you
How to bring
gently
you back and bring you back.
and bring you back. They know how to open you up when you
Yeah.
close. They know how to close you when you're open. So it may feel challenging, and it's normal. And I want to say this to the audience. It's normal to feel like you want to quit, because as you expose yourself, you feel vulnerable. That is normal in therapy. So because you feel vulnerable and scared, doesn't make that not a good therapist.
I got that.
Because she's containing you. That's your safe place. And so, so step 1, interview any potential therapist. And step 2, set forth your agenda in cooperation with, because they're going to see things that you don't see. So you have to give them some leeway. But they should not only accomplish their own agenda without your
Shouldn't it be a mutual thing, like what our goals are, and it's sort of a mutual thing that you want to work on? Do you flush that out? What is the goal?
We flush that out because,
Yeah.
and I'm pulling back the curtain for all my therapist friends and counseling. It's a big mystery sometimes what therapy is, but of course we want you to come in with what you think is wrong, but we know that that's not usually what it is.
Yes, it's something
and so,
deeper than that.
yes, because something has triggered you feeling like, and it could be something. So be open, but stay in control, lead, and a good therapist will follow you, but also guide you.
So good. So good.
Yes.
So let me ask you this. So there's group therapy and there's individual therapy.
Yes.
So I know the power of group therapy, having been a survivor of domestic violence 19 years ago.
Okay.
And I remember going into this room and thinking, I am not like these women. And then I remember...
And I'm not telling anything.
I'm not, oh my gosh.
I'm not opening up.
I was just like those women. And it was amazing. So I did group therapy and then I also did individual therapy.
Yes.
Together.
It is very common that if you're in a group, because you can't dig deep in a group. They don't have time for you to take the whole hour.
Right.
So it is not uncommon if you're doing group therapy that you'll also, combine that with individual therapy if you're feeling in a way that you need to express something more deeper, something deeper. So that is very common. So
I have a burning question.
Okay, go ahead.
But this is me. No, this is me coming from years ago.
Yeah.
Because I think the conception or perception, I should say, was that the counselors or the coaches or they were sicker than the patients. And people had that was out, that I don't know.
Yeah, I
come
have
from that he was sicker than the client. And then the thing was having them in therapy for 7 and 8 and 9 years. So I remember when I was coaching and had clients, I want you to be well in A, B, and C.
Yes.
This is not going to be a long-term plan. You're either going to get well.
Yeah.
I was thinking horrified. I know you've heard that.
Yeah.
That they're in therapy. They never just years. I mean, are we?
Well, yeah, and the people can totally get stuck in therapy telling the same story over and over and reinforcing the same story, right?
But I'll say again, a good therapist will know how to move you along.
Yes, good.
They'll know how to move you along. And a good therapist, like when I'm seeing someone, I know when it's time to terminate. I will start to slowly move. I will start to plant seeds. I will start to give skill sets. I will start, because I'm slowly letting them go. I start giving assignments. Yes, I'm starting to give assignments for them to act on their own, to release them from their dependency on me. And so it's a process for a good therapist. And
that's why I didn't want to be.
Yeah.
No, because I didn't want somebody hanging on me.
And there are many good programs. There are many good programs that require that the beginning therapists do their own therapy. And so they have that as part of the doctoral program or the master's program. Some schools do, some schools don't. Some people have already had their therapy, some people, but and insurance companies have made sure you don't keep people forever because you got 12 sessions.
That's right.
But
there are some people that need years. But a good therapist,
I know.
I've had people for 2 and 3 years.
I don't want to hear it.
Yeah, and it's deep.
Okay.
It may be very,
some
very
deep psychosis
deep.
there. I can understand that. It depends
Or
on the
some
situation
deep,
of severity of what they've been through, that person has been through. So I don't want to sound callous.
Right, because just as addiction is, and relapse, they say that in going toward being clean, the average is 7 relapses.
What?
7 relapses before you finally give it up for good.
7
Well, just like when I'm working with healing somebody emotionally, they're gonna regress several times. It's very hard work. It's very scary work. And so it takes time to, we were almost up the hill, but you fell back a little bit, but we were almost, and then we got over it.
And then the falls happen few and far between.
Yes.
Because they have the muscle.
Some conditions are scary.
Yeah.
Some people have been
I
harmed.
wonder if some people actually fear sobriety being scary for them to actually be sober.
That is the most perfect question, and let me tell you why. And those of us that are therapists know this. You cannot take away something without putting something back.
Well, but that's biblical.
Okay.
That's biblical.
Okay.
That's God's promise.
That is-
That comes
yeah.
straight from Him.
And so in therapy, sometimes if that person is not trained correctly, if they don't put anything back, something else could rush in.
Absolutely. And it comes back worse.
And so it
Talking
takes
about seven
time.
devils coming
I
back.
know.
More come
Right.
back. You get
Right. So if you think about it,
Let's fill the house with good things.
Yeah.
and so let's just simplify it. Let's get really simple.
Okay.
Let's just say I'm removing depression. You know,
Yeah,
we all feel
right.
depressed
Right,
sometimes.
right,
Yeah.
right.
I need to put something
Yes.
there, like a stopgap, like a door
Yeah.
stopper or
Right,
something.
right.
While I work on that,
Depression.
I need
Yeah.
to put something there, and then it's uncomfortable. I've been depressed for a long time, maybe. I have to relearn how to act, relearn a new skill set, some new coping skills. So I may regress a little bit, then I may try it again, then I'm happy about my success. Okay, what else do you have? Okay, and so it takes time
Step
for that
forward,
person
step
to
backward,
Yeah.
step
yes,
forward, step
for that
back.
person to adapt to a new way
Got it.
of
so
living.
let me ask you this. So, all right. So as an NLP practitioner, so I'm a timeline therapist, right, and practitioner. So what my understanding is with therapy, it can take up to 80 hours to get to one emotion, like for anger, for example. And then utilizing timeline therapy or the way that it's done, you're able to really get to the emotion the first time they experience anger. And where I'm connecting is
okay.
what you said is replacement, what you got to replace it with.
Yes.
So what you work on is getting them to the highest intention of that moment.
And you have to, it depends on what happened. So if I get a client that knocked out the teacher, then we can talk about anger probably a little faster. Because
that
now
is
you're
true.
in trouble and they're
Right
about to
there.
expel you from school.
Right.
So it always, the client will lead you as you lead him of what should come first. And I want to say this, remember that anger is a secondary emotion. It is not a primary emotion. There's no
Sadness.
such
That's
thing
right.
as anger. Right. Anger hides hurt, fear,
Yes.
and pain. And so it takes time to, you can't go straight to the shame. You can't go straight to the hurt.
Gotta
So
go
I
to
may
that,
have to
yes.
remove the anger
So
to
good.
get to
Yes.
what the core issue
Yeah.
is. And so sometimes it does take a lot of time. And if you move someone too fast, and this is the worst case scenario.
Yes.
If you take a person to their deepest pain too fast, they may have a realization and want to get out of here.
Wow.
So you don't want
Right.
You don't want that.
You don't want to be talking about
Right.
everybody molested me on the first day.
Right.
And that's just an example. You want to walk that person to where they can, I'm going to hold you as you, and I love the theory of containment. I'm holding you
Yes.
while you practice and fail and practice and fail and practice and succeed and practice and fall back and practice coming to terms with. It may take me a year for them to tell me that. But a good therapist knows.
A good therapist is patient.
Yes. And they know when you need to say it and when you don't need to say it. I had a professor, and I give a lot of people credit for where I am today. If you don't mind, I'd like to name them.
No.
Dr. Cheryl, Dr. Gary Bruss, Dr. Mark Lewin, Dr. Rebecca, Dr. Solovey, and they are some of the most caring people, and Dr. Sharon Lotion, some of the most caring people I've ever met. And they are so wise, and they've been doing this so long, that they know if they need to push you into saying it, or they know to let you.
Wisdom.
It's an inner caring that's so powerful that they know. And, and I hope that I know that same thing.
Well, you know what?
You know?
This has been so great for our viewers today to learn some of the insights about what psychotherapists and what coaches and counselors go through, but more importantly, what you need to know about selecting that counselor, selecting that help that you need, be it a psychotherapist, whether it's a clinical psychologist, a coach. reach out to someone, because
Yes.
I know that there are many people who are out there who are in pain. You're going through some things. You don't want to share it with Bessie. You don't want to share it with your friend. You want to share it with your husband. But there's somebody that you can share it with. So I want to thank you for listening, and thank you for being here today. Well, viewing and being here today. Carol is so much.
And can I give my contact
I'm telling you,
information?
can absolutely.
Okay, so the name of the book is
name?
Provoke Not Your Children. Provoke Not. How to Escape the Emotional Trap of a Narcissistic Mother. And you can contact me at Provoke Not Your Children, one word, at gmail.com.
All right.
If you have
that's
any
Provoke
questions.
Not Your Children at gmail.com. I want to thank you today for tuning in. Call your friends, tell them they got to see this show. We'll be up in a couple of weeks. And thank you again for being on Transformation for Success, the Total Woman Show. This is Dr. Barbara Young signing off. Thanking you.
Thank
for
you.
those in the audience. Thank you, guests, for coming in. Your questions you can give to Dr. Carol right after the show. Thank you so much. God bless all of you. Have a great time.
Thank you.
Yay.